How's it going, everyone? Dr. J here, osteopathic doctor obsessed with natural and alternative medicine. Today we're going to be talking about step 3 in my 4-step treatment for hair regrowth and stopping hair loss for men. Now, in the first several videos we talked about finasteride and minoxidil, which were both FDA approved medications that are typically advised by physicians over the past several decades. These are established treatments. The next 2 videos are going to be about treatments that are not as established, relatively new, not yet FDA approved, but still considered to be relatively safe and effective. And my gamble is over the next few years, we're going to see both of these treatments not only FDA approved, but starting to be recommended by some more Western physicians and Western medicine. Now, we're going to dive into these. We're going to learn all about these treatments. I use both of these myself. And if you watch until the end, I'm going to give you exactly how I use this treatment for optimal results. But you have to wait until the end. All right, let's get into it.
Let me ask you, what really makes a good doctor? If you're not happy, how are you supposed to help your patients?
Okay, red light therapy for hair loss. Now, this has been an established treatment for a long time for other types of disease processes, including for the skin, for joints. We know that using LLLT, low light laser therapy, is very, very effective for promoting mitochondrial action, promoting ATP, promoting cellular repair. The cytochrome C within that mitochondria actually absorbs this red light and kicks into action. However, it's still relatively new. We don't know the exact mechanism of how red light therapy promotes hair regrowth. There's several proposed mechanisms, but we do know that it works. And for all of my medical professionals watching this, saying there's no evidence that it works, you're wrong. I'm going to be posting the studies in the show notes here so that you can dive into the research a little bit and see that this is effective for hair loss. Now, because it's not FDA approved yet, I do feel the need to do that. I feel the need to also establish that, yes, there's going to be evidence that points in both directions. But the risk profile on this treatment is so low and the results are so promising, and we already know red light therapy works for various other diseases. So my guess is in the next few years, this will be approved for hair loss. It will be shown to have efficacy for hair regrowth. And this is something that I recommend that all men who are struggling with hair loss do and apply to their hair loss regimen. Because again, the risk profile is so low. This is a relatively affordable treatment. It's almost no side effects. So there's almost no reason not to try this. So let's dive right into the therapy. So red light therapy for hair loss. How does it actually work? What is it? So it's not something you have to go to a doctor's office or a clinic to get treatment for. This is something you can do right at home, right in your bed. And it's a product that you can get right online without a prescription, and that you only have to get once. So because of that, we may have some pushback from the pharmaceutical industry if this is shown to work really well, because it is relatively cheap because you only have to buy it once, and you can do it at home, you can do it without a doctor. So all of those things combined together mean problems for the pharmaceutical space. But I actually have 2 helmets. They've been sent to me by various companies. There is one that I recommend. But this is the one that I've been using. It is the iRestore. It's very discreet, kind of looks like a hat. Not that I wear this in front of people. But the reason I love this one is because it comes with an attached battery pack, so I don't have to be plugged into a wall, and I don't have to wear this giant contraption on my head. I just put this on for 7 minutes a night. It times itself. I push the button. And now I'm getting my treatment. I'm literally getting my treatment right now. It's shooting the red light therapy, the low light lasers into my head, penetrating down into my dermis, and the mitochondrial cytochrome C is absorbing that red light, and through whatever mechanism, it is producing hair regrowth, stimulating new hair follicle regrowth and health. Now, combined with the other treatments that I've been using, this is going to be a dangerous and synergistic, effective treatment. So definitely something that I recommend everybody do. It actually times itself, so after 7 minutes it's going to turn off. I recharge it about once a week, and as you can see, it is right now lit up red. These are the small little lasers that it's projecting into my scalp to deliver the treatment effectively. I'm going to go ahead and turn this off now. I don't even think I can turn it off before 7 minutes. I'm just gonna unplug it. But this is one of the helmets that I use. There's another one called iRestore, which I believe might be a little bit more effective. It's a little bit bigger. I'll drop the links for both of those if you're interested in purchasing one. But quite frankly, my goal here isn't to sell you a helmet. My goal here is to educate you on the therapy, teach you that this is an effective option. And to be frank, you can go on Amazon and get one of these for a couple of $100s. It's really an affordable treatment. You have to buy it once. And the intervention is so simple and so safe that why not apply this to your hair regrowth regimen? Why not? And I'm going to point to some of the studies to reinforce that reason as well. Now, thank you for staying with me until the end. This is one of the more simpler videos because, again, there is no side effects for red light therapy. It's a very mild therapy. And beyond that, it might have benefits beyond hair regrowth. If you use this red light on your head, not only will you regrow hair, but you might have skin benefits, you might have anti-cancer benefits, anti-inflammatory benefits, you might have cognitive benefits. Again, those are much less proven, but still highly likely. So, you stuck with me till the end. Let's talk about how I use this and how I recommend that everybody use this. Because a lot of these helmets are different. If you get the same one as me, you're probably going to use the same treatment regimen that I do. But again, the iRestore helmet, for example, instead of 7 minutes, it's 30 minutes, but less frequently. So what I say is try to get at least an hour in every single week, 60 minutes per week, whether that's 7 minutes 10 times a day or 30 minutes twice a week. This is something that everybody can do. It's relatively simple, and at night, when I'm ready for bed, when I'm winding down somewhere between 9 and 10 o'clock at night, I'll usually shower. I'll apply my minoxidil solution to my hair. I'll sit in bed, and as I'm listening to my audiobook, I'll be doing my red light therapy treatment for 7 minutes every night. Very simple, it's very quick, it doesn't hurt, it doesn't burn, it doesn't sting. You barely even know that it's there. It turns off on its own, I put it away, and it's really just one of the most, I don't want to say the most effective because I've been doing all of the treatments at once. You may not have results with just red light therapy. You may have to use it for 3-4 months before you start seeing any hair regrowth. That's just the nature of hair loss therapy treatment. But again, side effect profile very low, risks are very low, something that you should apply. Try and get an hour a week. There's a lot of different options in terms of products you can get out there. As with every hair loss therapy treatment, you're going to use this forever, for as long as you care. As soon as you stop treatment, you will lose your hair. That's just the nature of hair loss and the disease process. So just something to understand, something to get behind. You're doing this for life. But this is one of those things, very simple, very affordable, very low risk profile, and high benefits. FDA approval hopefully is coming soon. Right now it is FDA cleared for safety, not FDA approved for efficacy. But I believe that is coming soon. Again, for my medical friends who want to have a discussion, please head to the comments and let's have a productive discussion on this. I will also include some studies for you to look at. I'm sure you have your own studies that you'll cite that are going to be showing unclear results. That's fine. We'll have an educated discussion. All right, guys, if you enjoyed this video, please subscribe for more on men's hair loss, on men's health. Again, this is the leading channel for men's health now. So please subscribe, please drop a comment, hit that bell notification, and I appreciate you. See you in the next video. Bye.